Prozac, the brand name for the antidepressant fluoxetine, is widely recognized as a medication that helps to manage a range of mental health conditions. So, what is Prozac used for? Delving into its common uses, benefits, potential adverse effects, dosage recommendations, and dangers can shed light on its significance in the field of psychiatry. Primarily, Prozac is prescribed for the treatment of major depressive disorder, panic disorder, obsessive-compulsive disorder, and bulimia nervosa. Its selective serotonin reuptake inhibitor, SSRI, properties help to regulate the levels of serotonin in the brain, providing relief from the symptoms associated with these conditions. This video will delve into the common uses of Prozac, highlighting its benefits in managing various mental health conditions. We will also explore the potential adverse effects one might experience while taking this medication and review the recommended dosage guidelines. Additionally, we will discuss the precautions one should consider when using Prozac, as well as any potential dangers that may arise. Join us as we delve into the world of Prozac and explore its multifaceted role in mental health treatment. Common uses of Prozac. Prozac is commonly used to treat several mental health conditions. One of the primary uses of Prozac is in the treatment of major depressive disorder, MDD. MDD is a serious and debilitating condition characterized by persistent feelings of sadness, loss of interest or pleasure, changes in appetite, fatigue, and difficulty concentrating. Prozac works by increasing the levels of serotonin in the brain, which helps to regulate mood and alleviate the symptoms of depression. Another common use of Prozac is in the treatment of panic disorder. Panic disorder is a type of anxiety disorder characterized by recurrent panic attacks, which are sudden and intense episodes of fear accompanied by physical symptoms such as rapid heartbeat, shortness of breath, and chest pain. Prozac helps to reduce the frequency and severity of panic attacks by regulating the neurotransmitters in the brain. Prozac is also effective in managing obsessive-compulsive disorder, OCD, a chronic condition that causes uncontrollable, intrusive thoughts, obsessions, and repetitive behaviors, compulsions. By increasing serotonin levels, Prozac helps to reduce the frequency and intensity of obsessions and compulsions, allowing individuals with OCD to regain control over their thoughts and behaviors. In addition to these conditions, Prozac is also used for the treatment of bulimia nervosa, an eating disorder characterized by episodes of binge-eating followed by purging behaviors such as self-induced vomiting or excessive exercise. Prozac helps to reduce binge-eating episodes and improve overall eating behavior by regulating serotonin levels in the brain. Prozac's effectiveness in managing these conditions has made it a widely prescribed medication in the field of psychiatry. Benefits of Prozac. The benefits of Prozac in managing mental health conditions are numerous. One of the primary benefits is its ability to alleviate the symptoms of depression. By increasing serotonin levels in the brain, Prozac helps to improve mood, reduce feelings of sadness and hopelessness, and restore interest in daily activities. This can significantly improve the quality of life for individuals living with depression. Prozac is also beneficial in the treatment of panic disorder. By reducing the frequency and severity of panic attacks, Prozac helps individuals regain control over their lives and reduce the fear and anxiety associated with panic disorder. This can lead to improved social functioning and an overall better quality of life. In the case of obsessive-compulsive disorder, Prozac's benefits lie in its ability to reduce the frequency and intensity of obsessions and compulsions. This can help individuals with OCD regain control over their thoughts and behaviors, improve their daily functioning, and reduce the distress caused by these intrusive thoughts and repetitive behaviors. For individuals with bulimia nervosa, Prozac can be highly beneficial in reducing binge-eating episodes and improving overall eating behavior. By regulating serotonin levels, Prozac helps to decrease the urge to binge eat and reduces the feelings of guilt and shame associated with this eating disorder. This can lead to improved physical and psychological well-being. The benefits of Prozac in managing these conditions make it a valuable medication in the field of mental health treatment. Potential adverse effects of Prozac. While Prozac is generally well tolerated, there are potential adverse effects that individuals may experience while taking this medication. Common side effects of Prozac include nausea, headache, insomnia, drowsiness, and sexual dysfunction. These side effects are usually mild and transient, resolving on their own as the body adjusts to the medication. However, if these side effects persist or become severe, it is important to consult a healthcare professional. In some cases, Prozac may also cause more serious side effects. These can include serotonin syndrome, which is a potentially life-threatening condition characterized by high levels of serotonin in the brain. Symptoms of serotonin syndrome include agitation, hallucinations, rapid heartbeat, fever, muscle stiffness, and loss of coordination. If any of these symptoms occur, immediate medical attention should be sought. Prozac may also increase the risk of suicidal thoughts and behaviors, particularly in children, adolescents, and young adults. It is important to closely monitor individuals taking Prozac, especially at the beginning of treatment or when the dosage is adjusted. Any changes in mood or behavior should be reported to a healthcare professional immediately. It is essential to be aware of the potential adverse effects of Prozac and to discuss any concerns with a healthcare professional before starting or adjusting the medication. Dosage recommendations for Prozac. The dosage of Prozac prescribed will vary depending on the individual's condition, age, and response to treatment. In general, the recommended starting dose for the treatment of depression is 20 mg per day, taken in the morning. The dosage may be increased gradually, as determined by the healthcare professional, to a maximum of 80 mg per day if necessary. For the treatment of panic disorder, the recommended starting dose is 10 mg per day, taken in the morning. The dosage may be increased gradually, as determined by the healthcare professional, to a maximum of 60 mg per day if needed. In the case of obsessive-compulsive disorder, the recommended starting dose is 20 mg per day, taken in the morning. The dosage may be increased gradually, as determined by the healthcare professional, to a maximum of 80 mg per day if necessary. For individuals with bulimia nervosa, the recommended starting dose is 60 mg per day, taken in the morning. The dosage may be increased gradually, as determined by the healthcare professional, to a maximum of 80 mg per day if needed. It is important to follow the dosage recommendations provided by a healthcare professional and to never exceed the prescribed dose without medical supervision. Dangers and precautions of using Prozac. While Prozac is generally safe and effective when used as prescribed, there are certain precautions to consider and potential dangers to be aware of. One potential danger of using Prozac is the risk of drug interactions. Prozac may interact with other medications, including certain antidepressants, antipsychotics, and migraine medications, leading to potentially harmful effects. It is important to inform a healthcare professional of all medications being taken to avoid any potential interactions. Another precaution to consider is the risk of allergic reactions to Prozac. Some individuals may experience an allergic reaction, which can manifest as rash, itching, swelling, severe dizziness, or difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. Prozac should also be used with caution in individuals with a history of bipolar disorder, as it may trigger manic episodes. It is important to discuss any history of bipolar disorder or manic symptoms with a healthcare professional before starting Prozac. Additionally, Prozac may increase the risk of bleeding, especially in individuals taking blood thinners or nonsteroidal anti-inflammatory drugs, NSAIDs. It is important to inform a healthcare professional of any medications being taken to minimize the risk of bleeding. Prozac should be used with caution during pregnancy and breastfeeding, as it may have potential risks to the fetus or infant. It is important to discuss the potential risks and benefits with a healthcare professional before using Prozac during pregnancy or while breastfeeding. It is essential to follow the precautions and guidelines provided by a healthcare professional when using Prozac to ensure safe and effective treatment. Prozac versus other antidepressants. Prozac belongs to a class of antidepressant medications known as selective serotonin reuptake inhibitors, SSRIs. SSRIs work by increasing the levels of serotonin, a neurotransmitter that regulates mood, in the brain. Compared to other antidepressants, Prozac has several advantages. One of the primary advantages is its long half-life, which means it remains in the body for a longer duration compared to other SSRIs. This allows for once-daily dosing, making it more convenient for individuals taking the medication. Prozac also has a lower risk of drug interactions compared to some other antidepressants. This can be particularly beneficial for individuals taking multiple medications, as it reduces the likelihood of harmful interactions. In terms of efficacy, Prozac is considered to be as effective as other SSRIs in the treatment of depression. However, individual responses to different antidepressants may vary, and it is important to work closely with a healthcare professional to find the most suitable medication. Overall, Prozac's unique characteristics and efficacy make it a valuable option in the treatment of depression and other mental health conditions. Prozac and mental health disorders. Prozac has proven to be effective in managing various mental health disorders. Its ability to increase serotonin levels in the brain helps to regulate mood and alleviate symptoms associated with depression, panic disorder, obsessive-compulsive disorder, and bulimia nervosa. In the case of depression, Prozac can provide relief from the persistent feelings of sadness, loss of interest, and other symptoms that can significantly impact an individual's well-being. By restoring balance to serotonin levels, Prozac helps individuals regain control over their emotions and improve their overall quality of life. For individuals with panic disorder, Prozac can reduce the frequency and severity of panic attacks, allowing them to regain control over their lives and reduce the fear and anxiety associated with this condition. This can lead to improved social functioning and a better quality of life. In the management of obsessive-compulsive disorder, Prozac helps to reduce the frequency and intensity of obsessions and compulsions, allowing individuals to regain control over their thoughts and behaviors. This can significantly improve daily functioning and reduce the distress caused by this chronic condition. Prozac also plays a crucial role in the treatment of bulimia nervosa. By reducing binge-eating episodes and improving overall eating behavior, Prozac helps individuals overcome the challenges associated with this eating disorder and improve their physical and psychological well-being. Overall, Prozac's effectiveness in managing these mental health disorders highlights its importance in the field of psychiatry. Prozac and pregnancy. The use of Prozac during pregnancy is a topic of concern and should be carefully evaluated with the guidance of a healthcare professional. It is important to weigh the potential risks to the fetus against the benefits of treating the mother's mental health condition. Studies have suggested a potential association between the use of SSRIs, including Prozac, during pregnancy and an increased risk of certain birth defects, such as heart defects and persistent pulmonary hypertension of the newborn. However, the absolute risk of these birth defects is still relatively low. It is essential to have an open and honest discussion with a healthcare professional when considering the use of Prozac during pregnancy. The decision should be based on the severity of the mother's mental health condition and the potential risks to the fetus. In some cases, healthcare professionals may recommend continuing Prozac during pregnancy if the benefits outweigh the potential risks. In other cases, alternative treatment options may be explored to minimize any potential risks. Breastfeeding while taking Prozac is generally considered safe, as only a small amount of the medication passes into breast milk. However, it is important to discuss the potential risks and benefits with a healthcare professional before breastfeeding while taking Prozac. Conclusion: Prozac, the widely recognized antidepressant fluoxetine, is a valuable medication in the field of psychiatry. Its selective serotonin reuptake inhibitor properties make it effective in managing a range of mental health conditions, including major depressive disorder, panic disorder, obsessive-compulsive disorder, and bulimia nervosa. Prozac provides numerous benefits in the treatment of these conditions, including alleviation of symptoms, improved mood, and enhanced overall quality of life. However, it is important to be aware of the potential adverse effects, follow the recommended dosage guidelines, and consider any precautions and dangers associated with Prozac use. Individual responses to Prozac may vary, and it is crucial to work closely with a healthcare professional to determine the most suitable treatment plan. By delving into the world of Prozac and understanding its common uses, benefits, potential adverse effects, dosage recommendations, and dangers, individuals can make informed decisions about their mental health treatment.